tested positive for COVID. Can you provide any more details about that?
I can provide a bit more detail, just in saying that, as you know, we've had a number of public hearings where people have actually come to council. We were doing them entirely by phone. And yes, we did have someone who later tested positive. The risk was actually quite low because the person was part of an outbreak that sort of started later on. But we were within the window. And so the challenge that we ended up having was it was very easy to know who was sitting where from city staff, who was kind of within 6 feet, if anybody. And it was easy to contact the city staff and ask them to self-monitor for symptoms. The challenge was that there were lots of other members of the public there. And while we have their names, because it's in the minutes of who spoke, we don't necessarily have their contact information. And that can make the job of contact tracing very difficult. So these are the things I think that we really have to think about, because for a long time we only had the public hearings remotely. In the last couple of weeks you've allowed people back in. And the question we have to ask ourselves is that too big a risk? And so today we probably have about 25 people in there. There's different neighbors, people from different files and so on. And so the question I'm asking myself and I'm asking administration is, should we go back for now to a full phone-in system for the public hearings, which actually worked very well. It was actually a bit smoother than having a mixed system, with some people on the phone and some people there in person. So I think that's worth it. I should point out that the city, of course, has been very, very thoughtful in terms of our own cleaning protocols, in terms of our own social distancing protocols. So within the council chambers, most of the seats are actually blocked off. We can only have 25 people in there at a time. And others will sit out in a socially distanced area in the atrium, which is, for those who've not been, it's a huge multi-story atrium where there's lots of good airflow. We clean at every council break. We wipe down all the armrests. We clean the podium between each speaker. So we're taking a lot of precautions to make sure that people are safe. I'm just now starting to feel like people are probably safer if they're voting.
Are there any other positive tests associated with this?
Not that I know of. No, but I'll tell you, I myself got tested because just where I was sitting during that hearing, I happened to be within, at the very edge of what might be considered a danger zone, about 2 meters away. So out of an abundance of caution, I got tested and thankfully it was negative.
As for the face covering bylaw discussions that you're going to have, how do you deal with, just my own anecdotal evidence, places of misbehavior that would not be covered by the indoor places of misbehavior that wouldn't be covered?
For example?
Bars, especially high volume bars, especially bars on, say, just for example, 17th, where you go by, they're congregated like it's a cocktail party, and you can see from the outside right in. And
yeah, so
that's not covered by the masks.
No, it's not, because you wouldn't cover restaurants and bars with a masking bylaw because you can't eat or drink.
Right.
You might cover the public areas. So you might say, if you're in line for the washroom, you should have a mask on as opposed to if you're at your table. Those are details to be sorted. All of that said, I need to remind restaurant and bar owners that Alberta Health stipulations still apply. So you still have to have physical distancing, you still have to have barriers between your tables, and you're not supposed to be serving people standing up. People have to be seated at the table, they can't order drinks at the bar. So if there are bars that are violating those rules, I would really recommend phoning Alberta Health. And that is my understanding, I'm not Alberta Health Services. If they went and changed this and didn't tell me, then I'm just wrong. But my understanding is that is still the order. And so as a result, if people are seeing that kind of behavior, of people treating a bar like a bar, not a sit-down place, then, shall we say, treating it like a club, not a pub, then folks should phone Alberta Health Services because they're likely in violation.
Does that worry you, though, that some things will not be captured by any face covering bylaw?
Well, here's the thing about the face coverings, right? A lot of people are saying, why didn't you just do this in April? And the answer is because everyone was at home. And you're safer at home than you are out and about wearing, if everyone's wearing face coverings. The issue with why we're talking about the face coverings now is precisely because we're easing restrictions. precisely because people are out and about more. And so we've got to be really practical about this. You can't open a restaurant and then say everyone in the restaurant has to wear a face covering. So what we really need to do is mitigate the risk in places where we can mitigate it. So to me, I'll just put my own cards on the table before council's discussion. To me, doing it in transit is a no-brainer. So get that done, get it done today. Of course, there will be some exemptions for small children, for people with modified medical conditions. Just get it done today. Because we need people to take transit, we need people to feel comfortable on taking transit to open the economy again. Number two is giving our city manager the ability over the course of the summer to set criteria and triggers for city-owned facilities, including City Hall, libraries, and so on. In case the numbers continue to get worse while council's on its summer break, we can enact that. But I do think that it is time for us to look at a broader mandate in all indoor spaces with exemptions for things like restaurants and bars. I don't know that we have to put it in place today. A lot of epidemiologists will say do it today. And I should think that about more than half of the Canadian population is now covered by mandatory face mask bylaws in Ontario and Quebec largely. It's a bit complicated, and I would like to see a data-driven process. So what we're asking council to do is to allow administration to craft a bylaw. It really shows triggers. When do you do it on transit? When do you do it in city spaces? When do you do it in stores? When do you do it in all indoor spaces? And to come back in September. Now I will say that the one thing I would change in today's recommendations is I would say no later than September. Because if this uptick we've seen over the last couple of weeks turns into the beginning of a second wave, we'll have to move with that bylaw more quickly. You know, ultimately, I can't imagine why anyone would vote against the recommendations today. I think they are critical if you want to protect the economy and if you want to protect public health. You know, some of the arguments I've heard, you know, oh, it's an infringement on my personal freedoms. Well, you know, you have to have a driver's license to drive a car. You got to wear clothes to get service in most stores and restaurants. Those don't appear to be infringements on personal freedom. And I have to remind people, as I have so many times, the mask doesn't protect me. It protects other people from me. And so it is an act of community service. And we regulate stuff like that all the time. Littering doesn't hurt you, littering hurts the community. That's why you don't litter. And so I don't have any time for those arguments.
What are we going at which the city would declare another state of emergency if the cases continue?
No, don't say stuff like that. I would hope that this bylaw, if passed, would alleviate the need to declare a state of local emergency because we would have the bylaw authority to manage face coverings. If we don't, then remember that the mayor and one member of council can declare a state of emergency, and at that point, you know, in my reading of the law, we can mandate face coverings.
And you'd be able to mandate them in all other spaces under a state of local emergency?
I mean, I'm not a lawyer. That is how I would read the regulation on the Emergency Management Act. Others might read it differently. But I believe that under the Municipal Government Act, we do have the authority to mandate it in all indoor spaces now.
Sorry, without a soul?
Without a soul.
Well, what do you think, Mayor, of what's the end game if things do not get better and people don't do some of these things, or either voluntarily or don't even follow the mandatory?
I do not want to go back to lockdown. I do not want to go back to a position where we have to close businesses. We have learned a lot since April about the virus, and we squashed the first wave, which was important. We didn't squash it all the way to the bottom, but we flattened it and brought it down, got our healthcare system up to task in order to manage it. And now we're slowly easing restrictions, while understanding that easing restrictions is going to lead to more cases. But it's not just about people who die, it's not just about people who go to the ICU, it's not just about overwhelming the healthcare system. It is about protecting people's health from long-term impacts of this that we don't know what those are. But it's also about protecting the economy. Because the moment you start to overwhelm the healthcare system, we'll have to close everything down again. And nobody wants that. So if parents want their kids to be able to go back to school in the fall, we're going to need rules like this in place. And this is going to be very, very important. for us to be able to manage this. So someone asked me on the news the other day, you know, how long are we going to be talking about this? And the answer is, the longer the better, actually, because that's what flattening the curve means. If we can push this out to the point where there's a treatment and a vaccine, rather than having a huge wave of infection earlier, that really needs to be our end goal. And so, yeah, wearing a mask will actually prolong this, but that's a good thing. It means fewer people will get sick and the economy will continue to work.
What are some of the potential penalties a person will have to pay if they don't abide by the pension law rules and that sort of thing?
Just say it again, I just had something in
What are
my...
some of the potential penalties?
Oh, potential penalties. Oh, thank you. We haven't actually worked that out yet. That would be part of the bylaw. As always, we're not that interested in giving people tickets. We are much more interested in education over enforcement. We're much more interested in helping people understand how they can comply. So for example, my vision would be that if someone is denied boarding on a transit vehicle because they're not wearing a mask, that there would actually be packages of masks there for that person so they could take them and put them on. And those are the sorts of details that we need to sort out.
We just heard an update about Northland Mall and some of the changes to their redevelopment plan due to, you know, the economic changes in the last 4 or 5 years. Were you surprised to hear those changes? And the second part of that question is, do you anticipate more of these projects that have previously been spoken to council about changing due to the economic climate that we've seen change so much in the last 5 years?
No, I was not surprised because these are the sorts of things we're hearing a lot of. Even in 2015, when that was passed, it was a pretty aggressive plan. And in fact, I remember asking at that time, why don't you put some residential in here? And the answer was, well, the office market is so hot right now. So this plan is actually better to have some residential in there. And so we have lots of developers across the city pivoting. A lot of condo developers are pivoting to rental property, for example, right now. We have office developers pivoting to residential. And these are good things. This is the market working. But ultimately, because we have a lot of surplus office space around the city and in the downtown and everywhere else, it needs to be filled. But ultimately, once that's filled, the market will pivot again.